The assassination of President Abraham Lincoln was one of the greatest calamities the United States has ever faced. In order to capture John Wilkes Booth, the largest manhunt in American history occurred, until Booth was shot 12 days later at Garrett's farm. However, it has been speculated that Lincoln was already dying of a genetic disease at the time of the assassination. Photographs of the late president catalyzed this theory. These photographs were taken a year apart. Although every president's appearance has drastically aged throughout their presidency, none aged as much or as rapidly as Abraham Lincoln. Ailments known throughout his presidency include cold hands and feet, weight loss, and fainting spells. A long-standing belief was that Lincoln had marfan syndrome, but a newer theory proposes that Lincoln should be diagnosed with MEN2B instead. Marfan syndrome is an autosomal dominant disease caused by mutation on chromosome 15. An array of different SNPs have been discovered to cause this disorder. However, the notion that Abraham Lincoln had this genetic disorder is unlikely, despite a distant relative being diagnosed in 1959, because the symptoms are poor eyesight and a weak heart. Lincoln only needed reading glasses, and, as noted during the autopsy, Lincoln appeared several years younger and in good physical health. MEN2B is an autosomal dominant disease caused by mutation on chromosome 10 in the RET gene on codon 918. This mutation causes the production of threonine instead of methionine, resulting in medullary thyroid cancer, mucosal neuroma, digestive problems, muscle, joint, and spinal problems, swollen lips, and thick eyelids. The cancerous overgrowths of nerves from MEN2B could explain Lincoln's bumpy lips and face, use of a high collar, asymmetric face, and disproportionate height. Abraham Lincoln and Mary Todd Lincoln had 4 sons. 3 of them died before reaching adulthood. Their early deaths could be evidence that a genetic disorder was being inherited. Photographs show that the 3 who died all had bumpy lips, a symptom of MEN2B. Robert Lincoln did not have this abnormality. He survived to adulthood and became Secretary of War under Presidents James Garfield and Chester Arthur. Abraham Lincoln inherited his disproportionate height and facial features from his mother, Nancy Hanks Lincoln, who died of either a wasting illness such as cancer or contaminated milk. If it was cancer, it is probable that the mutation was passed down to her son and ultimately to her grandsons. The only way to confirm if Abraham Lincoln had a genetic disorder is a DNA test. Lincoln's body is securely encased in 4,000 pounds of cement to deter gravediggers, but several blood-stained relics from the assassination exist. However, museums and collectors are reluctant to sequence samples because preparation will cause damage to the artifact. All tests done so far have come up negative for MEN2B. Nonetheless, proponents of the theory claim that the samples were too deteriorated, contaminated by modern DNA, or contained the blood of Henry Rathbone, Lincoln's unfortunate guest at Ford's Theater, who was attacked by John Wilkes Booth. The creator of the hypothesis that Lincoln had MEN2B, John Sotos, has claimed that testing will continue until evidence of MEN2B is found. Due to the low occurrence of the disorder, if a sample contains the mutation, it can safely be assumed that it is Lincoln's DNA rather than Rathbone's or a modern sample. However, at this time, the theory cannot be proved or disproved, and until solid proof emerges, John Wilkes Booth will be known as the murderer of Abraham Lincoln.